My daughter Iona was at residential school, and that broke down when she became incredibly ill, and she was under palliative care. She came home and the services were incredibly fragmented, and we had enormous difficulty with agency staff, different people coming into our house, and really we had very little control over what we were receiving. We did have some experience after that of working very closely with our palliative care team, which freed up her teaching assistant budget, which was given to us, so we could then employ the teaching assistant from our home, so we had at least covered during her school day. But after that, when she was 16, we started talking about transition, and she was assessed as needing continuing health care, which in our area, because we're not in a pilot scheme, we couldn't actually have as a direct payment. So we were told again that she had to go to residential college to receive her care, and we obviously refused that because it had broken down once before. We were then told that we could have agency care, but we didn't want to go down that route because we tried that and that was a nightmare too. So we kind of held out for a personal health budget, and we did actually make our local authority give us one in the end. We worked really closely with our palliative care team to make that happen. So I think that was probably the picture that we had beforehand. So we had a little bit of knowledge of how we could have control over the people that were coming into our house, but having had that, we were terrified we might lose it, which we would under normal circumstances if we hadn't been able to get a personal health budget. It made an enormous difference. Firstly, I suppose just by being given the budget, even if you're not in a very good place, that in itself is quite empowering. Because what happens when you've been in the kind of whole service world, when you're dependent on people for services, you're waiting to be given things and you don't feel you can take control. So almost just in being given a budget, that can make a huge difference to begin with, because you can suddenly think, actually, yeah, I can do this, and I can do it better. But when you have a child with intractable epilepsy, basically every day is the unknown. You have no idea what's going to happen. I had to give up work because really I was the person that was going to be caring for her if she didn't go to school. The carers that were coming in weren't good enough that I could trust them to look after her. So the single biggest difference for me is that we now have people that we trust. We train them to look after Iona really well. We've developed fantastic emergency protocols. She's known to the local authority, she's known to the local hospital, and in fact she's known to the local hospice. So what it's allowed me to do is actually go back to work for the first time in 10 years. And I can't tell you how good that feels when you've been denied that kind of thing. So if anyone moans to me about going back to work, I was just like, whoa. So that's made an enormous difference. But more than that, it's allowed Iona to be at the centre of her care. And she'd just been a service delivery point. So now everything that we have around Iona works for her. And I think that's a really critical difference. It was actually really difficult because we don't live in a pilot area, so no one in the local authority or the PCT actually had experience of doing it, so we had to make it happen. And I think there is this kind of thing, there were two big hurdles that were put in front of us. One, that it was going to be too much pressure for me and too stressful. But actually, once you've battled the system for 18 years, nothing is going to be as stressful as that. But there are actually things that you can do to make the process more simple, like you can have good planning, you can employ a third-party agency, you can work with people that know Iona well, you can make some very good plans. So you can kind of negate all that extra pressure and stress. The other thing is people used to really say, but it's going to be very risky. Somehow keeping Iona was going to be riskier than sending her to a school that didn't work out. So that was always one of these things you just think, really? But just to give you an example of that, the school that she went to had protocols for everything and risk assessments for everything, which would have meant that she'd have to have a gastrostomy, that she would have had to wear a spinal brace because she had a mild scoliosis, that little things like she would have had to have a table in front of her wheelchair. And given that she communicates non-verbally, that provided a real big barrier between her and her PAs, and that she would have had to have increased medication for her seizures. So all of those didn't work, and that was risk being overmanaged. So we're not stupid, we don't ignore risk altogether, but we kind of do it in a kind of positive way. So we train the PAs incredibly well in epilepsy procedures, we have fantastic emergency protocols, and we train them in things that matter to Iona, like communication and sensory curriculums, so that actually we risk manage positively rather than over manage risk. Because we don't live in a pilot area, we've had to break through all these things and go through these barriers that we've had to overcome. But in doing so, we've addressed lots of issues that will come from families coming behind us. And I think actually the local authority are now really positive about it, and they really want to make this happen for other families. So something that's been difficult for us has actually shown them the way forward for other families.